So today's topic is the right atrium of the bovine heart. As we know, the heart it is consists of the four chambers: right atrium, left atrium, right ventricle, and the left ventricle. Now, the first chamber of the heart, that is the right atrium. The right atrium is smaller as compared to the left atrium. It forms the right anterior part of the base of the heart, and it is placed above the right ventricle. The right atrium consists of a main cavity that is known as sinus venosus or sinus venorum, into which the main veins open. And the next part is known as is the blind diverticulum, or a conical pouch that is known as auricle or auricular appendix. This auricle or auricular appendix, it covers the anterior face of the aorta, and it is blind, and that remains in front of the origin of pulmonary artery. The internal structure of right atrium. The right atrium, it is lined with a smooth gelatin membrane that's known as endocardium. The endocardium, it lines the atrium, and it is continuous with the ventricles as well as the blood vessels that enter the right atrium. So the anterior vena cava, it is placed on the dorso-anterior aspect of the sinus venosus, and it is placed opposite to the fourth rib. The anterior vena cava, it carries the blood from the anterior part of the body of the animal. Posterior vena cava carries the blood from the posterior part of the body of the animal, and it opens on the dorso-posterior aspect of the sinus venosus. It is placed opposite to the fifth intercostal space. There is a ridge that is known as intervenous crest or intervenous tubercle or tuberculum loweri that projects from the dorsal aspect of the sinus venosus in front of the opening of the posterior vena cava. The main function of the intervenous crest directs the flow of the blood from the anterior vena cava towards the right atrioventricular orifice. So just below the opening of the posterior vena cava, there is opening of coronary sinus. Here at the coronary sinus, great cardiac veins and the venous hemiazygos opens. This coronary sinus, it is guarded with a semilunar fold of endocardium, which is known as Thebesian value or value of Thebesius. On interatrial septum, there is an oval-shaped depression which is known as fossa ovalis. This fossa ovalis is a fetal remnant of foramen ovale. The auricular appendix, it is not smooth, and it is thrown into muscular ridges. They are known as musculi pectinate or pectinate muscles. These pectinate muscles, they will terminate above on a curved crust that is known as crista terminalis. On the floor of the sinus venosus, there is an oval-shaped opening which is known as right atrioventricular orifice, which communicates the right atrium with the right ventricle. This right atrioventricular orifice is guarded with a tricuspid valve. This tricuspid valve is made of three cusps. So in this diagram, you will see this is the main cavity of the right atrium, which is known as sinus venosus or sinus venorum. This is the blind diverticulum, which is known as auricle or auricular appendix. This auricular appendix, it is thrown into muscular ridges. They are known as pectinate muscles. And here is the posterior vena cava, and this is anterior vena cava. The anterior vena cava, it opens at the dorso-anterior aspect of the sinus venosus, and posterior vena cava opens at the dorso-posterior aspect of the sinus venosus. Just in front of the opening of the posterior vena cava there is a crust that is known as intervenous crust or intervenous tubercle, and below the opening of the posterior vena cava there is the coronary. This is the opening of coronary sinus where the great cardiac vein and vena hemiazacus opens, and this is the right atrioventricular orifice. It is guarded with these valves. Tricuspid valves are there. These are the valves, and these valves are connected with these chordate fibrous cords known as chordate tendinae. And here there is a depression that is present on the interatrial septum. This is known as fossa ovalis. Thank you.